Hi, this is Samira from the Movement Therapy Studio. Today we'll be explaining a little bit about what dry needling is. I'm here with Dr. Dommerholt today from Myopain Seminars, and we're here to explain a little bit about what dry needling is. So if you don't mind by starting, Jan, exactly telling us what dry needling is.
Okay. Dry needling is a technique used primarily by physiotherapists in many countries around the world. Dry needling started in the late 90s, really, that people became interested in it, but it was developed out of injection therapy for myofascial pain. So in the 1940s in the United States, a physician, Dr. Janet Travell, who's probably best known because she became President Kennedy's doctor, developed trigger point therapy, looking at myofascial trigger points, knots in muscles as a source of pain. She treated these with injections, and much later in 1979, 1980, the first studies appeared that showed that using solid filament needles has the exact same effect, and that was really how dry needling got started.
Okay. And what type of conditions would you suggest are beneficial for dry needling?
Okay. Truthfully, dry needling can be used for almost any pain condition, whether it is tension type headaches, migraines, carpal tunnel syndrome, low back pain, sports injuries, athletic injuries, etc., etc. As long as people have pain, the musculoskeletal system is always part of a pain problem.
Jan, do you mind explaining for us briefly exactly how dry needling works?
That's kind of a difficult question to answer because no one really knows exactly why dry needling works. So we know a lot of things that happen when we do dry needling. For example, we know that the trigger points, the knots in the muscles, are very hypoxic. What does that mean? The muscles are so contracted that blood flow can't really get in to the muscle. And because there's a lack of oxygen, because the lack of blood flow means lack of oxygen, there's a drop in pH, so it becomes very acidic. The nervous system responds to that by releasing lots of chemicals, and these chemicals then in return cause a lot of pain. We know that with dry needling, from multiple lines of research, we know from dry needling that once you hit that trigger point with the needle, that all these chemicals immediately decrease. By doing that, we actually reduce what's called nociceptive input. By input that leads to pain eventually, we can reduce that input dramatically and really solve a lot of these pain problems.
And what would you say are the pros and cons to receiving some dry needling treatment? The
pros, let's start there. The pros are that it's very quick. The results are very fast, and usually even with the first treatment, patients can feel a difference in their pain levels. And that applies to any of the conditions we talked about. The cons is that it is a little bit uncomfortable. So people experience when the needle hits the spot, an involuntary contraction of the tight area, that's perceived as somewhat painful by some. Most people say, look, well, it really wasn't that bad. And almost everyone says afterwards it was well worth it because it was really good. Now the pro from it is that it's very inexpensive. The needles are very inexpensive. We can treat people without a lot of pharmaceuticals, without a lot of need for expensive tests. And once people have pain, and we know for sure there are no major pathologies, no major problems, we can use dry needling very quickly and efficiently.
Here at the Movement Therapy Studio, we are collaborating with Jan to bring the dry needling courses here to the UAE for health professionals so that we have more therapists that can provide this treatment. Whilst we both know there are already existing dry needling courses here in the UAE, can you tell us what makes your courses different to others?
Yeah, that is a tricky question also, because I'm not totally sure what other programs teach. So I don't want to judge a program by its cover and not know what exactly the program entails. I teach courses all over the world, and typically what happens is that there are a lot of courses out there that teach people the trick how to put a needle in a muscle without necessarily having the broad range of evidence, without knowing exactly why are we doing that. I think healthcare professionals in 2014 and 15 need to have a solid evidence-based basis why they do things. One really big difference with our courses, with other course programs, is that we actually go through what is the scientific basis for doing this. Our students will have to study a little bit. They will be exposed to lots of scientific articles. There will be a test at the end, a certifying examination that we teach all over the world, that we have many clinicians in Europe, in the United States, and even in South America have taken these exams. So we know they're valid, they're reliable exams, and we really make very high qualified, certified clinicians in joint needling.
Thank you.